this is unfortunately true. There are certainly some physicians who will not do a prior authorization and certainly won't do an appeal or a peer-to-peer because they have learned the hard way that regardless of what they do, the medication or the procedure will be denied. And there are certainly times when, unfortunately, there is nothing that we can do. For example, if something is a plan exclusion. If something is a plan exclusion, then you can't even do an appeal or a peer-to-peer. If the policy says that they do not cover treatment for a certain disorder, such as obesity, at all, then you can write how many letters you want. They're not going to cover it. And doing prior authorizations and appeals and peer-to-peer are time-consuming and soul-sucking. Doing these videos and writing my angry letters to a certain extent is cathartic to me. And so, in addition to trying to get what I need for my patients, being able to tell insurance companies how I feel about their denial is psychologically helpful for me. But I can understand how people don't have the time or inclination to do this kind of thing. And sometimes it is just easier and still medically acceptable to switch a patient to the formula alternative. For example, I think many generics are fine alternatives to brand name medications, and within a certain class of drugs, very often the medications are similar. Having said that, once a medication is deemed medically necessary and is covered, I see no reason to have to go back and get it approved over and over and over again. And once I've gotten to the point of doing the prior authorization and the appeal, clearly I think it's medically necessary, and I fail to understand the need to repeatedly do that. But yeah, there are certainly, physicians, there are certain physician offices who have taken the path of least resistance and will not do prior authorizations and such. And that's unfortunate because sometimes, the thing that is medically best for the patient is the thing that's worth fighting for.